All right, good afternoon, everybody. Now we'll be treating some basic indicators that your body is about to ovulate. Some signs you have to see in your body that indicate that your treatments are going well, that your body is normal, your hormones are still okay. All right, let's go ahead. Okay. The basic signs that you see that indicates that you're about to have your ovulation is one, the physical sign. The physical signs followed by emotional sign, the psychological sign, there are other signs. So now we're taking the physical sign. Okay, the physical sign includes the mucus increase. The cervical mucus continue to increase once you see your menses after some of your free period. You see that the pap sets in. When the pap sets in, you see that it's keep on increasing in quantity. At that point, it becomes clearer, it becomes tiny, and it becomes much more abundant, and it resembles egg white. Okay, the next one we are seeing is the basal body temperature. When we talk about the basal body temperature, there is shift at that point. There is increase in your temperature slightly, and immediately ovulation sets in, you find out that it rises again. All right, the breast tenderness is another thing. Once your ovulation approaches, you notice some kind of tenderness in your breast, your nipples, and the rest of it. So at that point, you find out there is surge in your breast, and it's an indicator that your ovulation is about to drop, without seeing it as you're having some signs of tumors and the rest of it, as people are calling an accent. All right, we'll go about the fourth one. The fourth one is mild pelvic discomfort. This is different from the normal cramping that you're having. There's some discomfort somebody will be having around the waist as if it's a bit heavy at that point. Those are signs to show that you're having ovulation as close as possible. Now, another one is the emotional and psychological signs. What are these emotional and psychological signs? That's when you talk about increase in libido. When we talk about increase in libido, because the basic hormones like estrogen has already arisen. So when there is increase production of those estrogen or the surge in the system, you find out there is high increase of sex drive at that point, and this is emotional side of the signs that you see that indicates that ovulation is setting in. Another one is mood swing. Sometimes you have mood swing because of the hormonal infiltration that can lead to a lot of irritability and anxiety at that point. Maybe someone is not prepared for taking in at that point, or you're tense because you've prepared yourself. That tense and anxiety at that point can actually come because of the fluctuation of the hormones. Another one is the increase in energy. You find at that point that these hormones are such. Some women experience a lot of surge in energy and vitality. You see those women, we see some women at a particular time, they are so energized, they're so beautiful, they prepare themselves, they are so attractive, they have so much energy, they are so positive vibed. Do you understand? So at this point, notice that what is happening in the system is as a result of ovulation that it's actually about to drop. The body is already set to it. Okay, another one is those signs that is associated with ovulation. Pain. When you start having some experiences, you start having some pains around your pelvic. It could actually be pain by the side of the ovaries, left or right side, depending on the one that the eggs are ruptured. The eggs are actually growing fast on. Okay, so at that point, it could actually last between few minutes and few hours. As you see the pains, those cramp that comes, it keeps getting a bit deeper, the pains, and as the hours increase, you find out that it's increasing in the pain, the inflammations, the pain you're having under that pelvic regions is increasing either by the right or by the left. And at the time you notice that the pains are reducing, the inflammation is reducing and almost disappearing, know that the egg has already ruptured. That is ovulation peak at that point. All right, so another one is the light spotting. Some people experience drop of blood stain, bleeding while they are about to ovulate. Okay, at that point, just know it's still okay. It occurred due to the hormonal changes as well. Another one is the heightened of sensitiveness. That sensitivity someone becomes at that particular, the height of senses that someone actually get attached to. Do you understand, or experience? You see some people get increased sensitivity to smells, increased sensitivity to sounds, to visual stimuli. If you touch the person, it gets so sensitive. Whatever it is, even if you're joking, whatever it is, the person gets so sensitive, overreact as normal, as a normal person he or she used to be. At that point, you notice they're a different you at a particular time. Relax and know that this is all associated to ovulation. All right, for the people who are having those kind of symptoms too. Okay, another one I have to treat quickly is how to be able to predict that same ovulation, regardless of those signs, to just be sure. We have ovulation predictor kit that is in some of the pharmacy shops. You can be able to get it. You use your urine, test the luteinizing hormone there. Once you test it and the concentration of the test line and the control line, you see the C being the control and the test line. Once you see the concentration increasing and be a little bit higher than the concentration of the control, just know that you are at that point of your ovulation, that it has already ruptured. So with this, you can actually help yourself. Another one is your fertility app. Some people track ovulation based on menstrual cycle, which is right, and the dates using the fertility apps and other factors as well. I've treated how to be able to track your ovulation. If you're in low cycle, understand that the peak is dividing the first menses you see to the next menses that is about to drop. That counting from that and the next one, dividing it into 2 gives you your ovulation. So if you're 25, know that it's 12.5, which is on the 13th day. I've explained it. There's another idea you can actually take that will help you be able to track your ovulation well. You can use your basal body thermometer, tracking temperature changes to identify your ovulation. When you see the temperature keep increasing, you know you're actually approaching to that very ovulation proper. Keep in mind that all those experience and signs are so different in all the individuals. The same thing I feel will not be the same thing you feel, though it might be similar, but just understand it's not a disease condition. Understand it's just a pathway to make you understand that it's so easy to be able to gather the signs in your system, be able to pinpoint what it is, and be able to track yourself at home, and then increase your chance of fertility. With those little symptoms, I believe it will help you go a long way to be able to get your conception so fast. So we thank you for the subscription. Thank you for everything. Thank you for listening. All right, remember.